3-minute challenge for Career Explorations 1. Let's do this. First, we will tackle about the early inventions and discoveries that led to the advancement of modern medicine. In Greece, Greek physicians developed a system of diagnostics and observations. It is also estimated that more than 90% of medical terms used today have Latin or Greek origins. The medical practices in ancient Egypt laid the groundwork for modern medicine because of its similarities between the current health system. In early Mesopotamia, the Code of Hammurabi was one of the first documents to outline patient rights. It provided equal treatment for both rich and poor. Almost 3,000 years ago, Emperor Wang Dinei Jing wrote the Yellow Emperor's Canon of Internal Medicine, which is considered the oldest medical textbook in the world. Around 100 AD, famous physician Hua Tuo developed anesthesia. This paved the way for Chinese understanding of anatomy because of their experience in surgery. In 1628, William Harvey published an anatomical study of the motion of the heart and blood in animals, which is a groundbreaking book that explained how the blood was pumped out of the heart, circulated through the body, and returned back to the heart. He learned about the circulatory system. Philosopher Robert Boyle started working on an air pump that led to the discovery of the Boyle's Law, which explained the mechanisms of breathing oxygen. In the mid-1600s, Robert Hooke was able to make a simple compound microscope that was able to observe a microscopic fungi. Years later, Anton van Leeuwenhoek came along and started to make a microscope that could actually magnify an object 200 times more. A French physician, RENE THEOPHILE HYCINTHE LAENNEC, began to use a wooden tube that is 10-inch long, 1.5-inch wide, to hear women's breathing without embarrassment. He presented the idea of a stethoscope. In 1796, Edward Jenner inoculated a 13-year-old boy with vaccinia virus or cowpox and surprisingly demonstrated immunity to it. After writing his own book about it, he called it vaccination. James Lind, a Scottish physician, first ever to use a clinical method and cure scurvy with a solution to typhoid. He discovered vitamin C deficiency. John Hunter, a British Army surgeon, developed a procedure for a tracheotomy. He used a reed as a small tube to be inserted through the neck into the trachea. He developed a double bellows system for inflating and deflating the lungs, which became a common life-saving method. In 1718, Jean-Louis Petit developed a double-screw tourniquet system, which improved the physician's ability to control bleeding during procedure and also improved the outcome of amputations. Insulin is a life-saving treatment for diabetes. Through collaboration of doctors, Frederick Banting, a Canadian surgeon, discovered the connection of diabetes to the pancreas and diet, and so made a groundbreaking history that saved the patients' lives.